Next question, is there an endpoint to use of LDN? I've had a few patients who have been on meds long-term, SSRI or opioids, who don't want to trade one med for another. So I have patients who've been on LDN for years and years. Normally, once they get on LDN, they can actually decrease a lot or discontinue a lot of their other meds, and they keep on LDN as kind of that maintenance dose. And we've had people 10 plus years on LDN doing wonderfully. So normally I tell them to continue. What I do see is when they think everything's great and they want to stop, they're like, it's been 6 years, everything's great, I don't need LDN anymore. Well, they stop. 3 months later, we see their name come back up for a refill because they've had some type of flare. All of a sudden, usually around 3 to 6 months, things get a little, their immune system starts going a little haywire again. So I see that actually happen pretty frequently.
So unfortunately, I think what we're saying is, yes, you are trading one medication for another. And we were doing some training with a couple of doctors a couple of months back, and I think when I think they thought I was trying to sell a pyramid scheme, because I was sort of saying, well, you can stop all of these things and then you go on to this. But then one of the doctors kept saying, but do they just stay on it? It's not, I said, well, it's not a cure, but it's better than all these things, and it keeps making the better. And one of them just looking at me like, well, why are you trying to sell me this? And now 2 months later, once those doctors have now started giving people LDN, they're giving it to absolutely everybody because the results that they're seeing are so much better than any of the other medications they had before. So,
you're right, because low dose naltrexone has so very few side effects, and it has so very few drug interactions. I mean, it's low dose, it's low risk, it's low side effect profile, it's low cost even. So with that, you might be trading one for another, but you might be trading a better one for what you've been on.
Cheaper with fewer side effects and fewer long-term complications.
Who doesn't want that?
Yeah.